Two interesting, if very different stories for us tonight from our Eastern Ontario Hub editor. He is David Rockne Corrigan on the line from our studio at Queen's University in Kingston. Welcome to the show.
Hi, Jan.
Now, you have a story coming out this week about green burials. What exactly is that?
Well, the word green is probably a dead giveaway. Oops, sorry, no pun intended there. It's really this idea that people being buried want to have fewer barriers between their body and the natural space, the natural earth around them. You think of embalming fluid, which is used to keep people looking lively after death, and it's a carcinogen. It's bad for the environment. Cremation. It burns, often burning fossil fuels, sending chemicals into the environment, also seen by some as a bit of an environmental no-no. So it's this idea, and I'll talk about the demographics here. We're probably looking sort of at the older generation of boomers who, were sort of adults as the environmental movement was picking up and are thinking, I don't really want to be buried in a big concrete vault. I don't want to, have any kind of ornate steel casket. They just want something simpler.
Now, you were in the Glenwood Cemetery in Picton. Now, what's happening there when it comes to green burials?
Yeah, so I visited the Glenwood Cemetery in Picton. If you're not familiar, it's a really old, 1870s. It was first founded in really in the heart of Picton. So it's you have people walking through the town. It's sort of odd to see a cemetery sort of right in the middle of town. But I was there visiting, and they've recently made a section dedicated to green burials. So it's about a quarter of an acre, roughly the size of 2 basketball courts. So not huge, but they've plotted out 35 markers where people will eventually be buried. And when they announced the news, actually they've been fielding phone calls almost every day since. They've sold a few of these plots. And this cemetery, Glenwood Cemetery, in setting out this special section, they actually also became the second cemetery in Ontario to be certified by the Green Burial Society of Canada.
You mentioned certified. What exactly does that mean?
Sure. So I say certification. It's really a statement of principles. So this is a group of cemeterians and community leaders who got together and sort of came up with a statement of principles. They've got 5 of them, and I'll just quickly go through them because it's interesting. And the first one I already mentioned, no embalming. The second one is direct earth burial. So this is not necessarily putting the body right in the ground, but covering it up with something simple like a shroud or a simple wooden box. And so that is seen as a more environmentally friendly than, again, as the big sort of ornate, fancy steel caskets that we often see nowadays. The third one is ecological conservation and restoration. So the idea that the body, after the body's been buried, that they plant native flowers and native trees, native plants to sort of encourage ecological conservation in that area. Another part is communal memorialization. So this is as opposed to individualized memorialization, where you would see individual gravestones and plots. In a green burial, they want to keep these really small. So there may be a small little plaque or a small marker, but even the way that it's memorialized is thought to be more communal. So in Glenwood, for instance, they're going to have in the center sort of a big boulder where people can sort of stand, and the idea is that you're remembering your loved one that's there, but within this sort of beautiful forest that they've set up in Glenwood. So it's an untouched piece of land. When I went there, that the sun was poking through, and right in the center, the plan is to have a place where people can sort of come to remember their loved ones. And then, of course, this land, and the last principle of Green Burial Society is optimizing land use. So, putting these graves close together and using the land in the most efficient way to make this happen. So, they tell me that it's probably going to cost roughly the same for somebody to bury one this way. However, for the cemetery itself, there's going to be less maintenance costs. So they still have to maintain all those other graves that have been there for the 100 and some odd years. But now with green burials, the idea is that they can sort of pull back some of the money that they make from that and use it on maintenance elsewhere. So that is what the certification means. The other place in Ontario that has it is Niagara Falls. They actually have a much bigger operation. It's 2 acres with about 700 plots. So those are the 2 that are certified. And there are a few others in Ontario as well that don't yet have that certification or maybe in the process of getting it.
Now, I am curious, there are cultural groups and religious groups for whom a coffin-free burial is the norm. How is this any different?
Well, JN, frankly, it's not very much different. Yeah, some people might be watching and saying, well, you know what, I think that my grandfather was buried and had a green burial, because in Muslim and Jewish tradition, often there is no embalming, and there is, a burial, as you mentioned, in a simple wooden box or in a sheet or a shroud. So yes, these are practices that have been going on for a long time. And actually, the cemeterian at Glenwood that I spoke to, she was talking about how it was really sort of in the late 1800s and 1900s that people moved toward these, bigger caskets and concrete vaults, and that's when you started to see that. So this is sort of pushing back against that, and yes, adopting some more traditional methods, really, of burial.
I'm going to change gears a little bit. Last week, you wrote on an issue related on our growing gig economy and how that's kind of having an effect with people getting dental benefits and seeing their dentist. Tell me exactly what that's all about.
Sure. I'll start here with a little personal anecdote, because this is something I've been seeing for more than a decade. I'm someone who, in my own, throughout my 20s, I worked full-time or in contract situations, and I found that without benefits, a lot of these jobs didn't have any kind of dental insurance, that I just skipped going to the dentist. So there was probably, and I hate to admit this on TV, but I probably didn't visit the dentist for about 10 years. And then when I did get a job that had some dental benefits, I definitely used it. I got some work done, and that was very helpful. But I spoke to others. I wanted to know this story because I'm hearing about this, and especially, we talk about the gig economy and a lot of short-term contract work that people are getting, but without those employer benefits that you would typically be seeing in earlier generations. And the Wellesley Institute actually did a study a couple of years ago showing that about 1/3 of people in Ontario that are working full-time don't have any medical or dental benefits. So it's a huge segment of the population, and it's growing. We know from an economic survey that BMO did recently that the gig economy is expected to continue to grow. So this is a growing segment of the population. One person I spoke to, she told me that she's been relying on her husband's benefits. Well, I know a lot of people are in that situation as well, and she said that her husband recently lost her job, and one of the first things she did was call up the dentist and cancel her appointment.
Now, some experts are calling this an urgent public health issue. Can you talk a little bit more about why exactly, in terms of on the health side, why is this an issue?
Sure. Well, I mean, there's a growing body of evidence suggesting that our oral health is connected to our overall health. So some things like heart disease, can be attributed to poor oral health, and stroke, cardiovascular disease. There are reasons why dentists and sort of oral health professionals and dental hygienists are sort of ringing the alarm on this one, because these other things are costing. They're not only just bad for Ontarians' health, but it's actually costing the government. There's one stat that the Ontario Oral Health Alliance put together suggesting that about $38 million is being spent needlessly in Ontario hospitals because people are showing up at emergency rooms with tooth problems, and of course physicians aren't they're not trained to be fixing teeth. So often, I mean, they may give you something for pain, but they will show you the door otherwise. So then this person is forced to either live with that pain or find a way somehow to get to the dentist.
Now, there seems to be some help, but it seems to be geared towards seniors. The Ford government recently announced their dental care program. Tell me about that.
Yes, sure. Yeah, and before I do that, you're right. There is some help out there as well for use. There's a program called Healthy Smiles Ontario, and children from low-income households may qualify for that, so that's another option for people out there. But yes, just more recently, in April, the Ford government announced a dental care program for seniors. So this is geared towards 65 and over who have a income of less than $19,000. Is $19,300 is the cutoff line. And it's going to be a $90 million a year program, and it's going to be administered through community health centers and public dental clinics. And the idea is that the Ontario government is saying that no senior in Ontario deserves to not have good dental care. I definitely commend, as many others are doing, commending the government on this one, because seniors are more susceptible to some of these oral health diseases that I mentioned. But that said, there are still others who think that there are gaps that need to be filled, in that while some seniors and some youths have coverage, that there are still too many in Ontario without coverage and who are not going to see the dentist, whether it's for cleaning or preventive work.
All right. Well, David Rockne Corrigan, always a pleasure to chat with you. Two very interesting stories. I'm sure your dentist will be calling you probably after they see this later tonight. Thanks again. That's David Rockne Corrigan from our Eastern Ontario hub at Queen's University. Thanks again.
Thank you.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario, helping businesses stay on the right side of change with strategic thinking, insightful decisions, and business leadership. Are you on the right side of change? Ask an Ontario CPA.